Hello, everyone, and welcome back to a new episode. Today, we have a very remarkable pharmacist whom I had the pleasure of listening to her presentation recently about skincare. Andrea, please tell us, how did you enter the field of healthcare and what influenced you to become a pharmacist?
Hi everyone, thank you, Meta, for having me on your podcast. It's actually a very nice question because since I was a kid, I was born in a family that they are like full full of engineers. So when I was small, I used to like read books about like medicine and like science, biology, and like I was always the intrude in the family that did not do engineering. So I used to watch like a lot of like series back in the days. I don't know, like I had my passion like to into science, into healthcare. At first, I wanted to do medicine, but then my parents were like, no, like you can't do medicine, like you should go and enjoy life. So I ended up doing pharmacy, which is quite actually the same in terms of like years of studying. So that's how I ended up being a pharmacist.
Amazing. And which university did you go to?
I actually did my pharmacy degree at the Lebanese American University, LAU.
Amazing. And what were your involvements like during university as a pharmacy student in terms of extracurriculars, any placements you had?
Yeah. So the first 2 years, like our program, it's a bit different. It follows a bit the American model. So the first 2 years were like they were called pre-pharmacy. So this is where like you take all the extra courses that are not technically pharmacy related. And after the second year, out of the 100 students, they only choose 70 students based on their GPA for the first 2 years and the interview. So when I succeeded and I was one of the 70 people, I've decided that I wanted to run for class representative. So I did run for class representative, and it was actually a big role to fill because you had to. You had to develop the white coat ceremony, take care of it, because as you know, it's a very important ceremony for the pharmacy student. This is where you do the oath. This is where you take the oath in order to put the patient's life first. So that was a very big project that I had to take. It's a lot of work. So I'm pretty sure that you have something like that in your university, but like don't underestimate the role. First of all, it puts you in contact closely with the doctors, with the deans, with the school of pharmacy, which open your eyes on different things. And because I got this role, I got super close to one of my doctors at a time. He used to teach the biochemistry course, and he was like, you know what, like why you don't give tutoring for people who need an extra push in having like more advanced courses on biochemistry. So I did that during my university as well. I was always on the dean's distinction list. And in terms of extracurricular activities, there were certain things like, the typical normal things that each pharmacy school has, like, you volunteer in certain groups, such as like the Red Cross group, the biology group, all of those things. So I used to do them like here and there, but because like being the class representative and the biochemical tutor took most of my time, so I focused really on those two things.
Oh, that's amazing. And as a pharmacy student, did you have any idea of what specialty you would like to pursue in pharmacy?
Honestly, in my university, they were super keen on pushing all the students to do the PharmD, of course, and then the residency. So we weren't offered like different options on what should we do. They were like super focusing on like, yes, after you finish your degree, you go into residency, you practice as a clinical pharmacist. We didn't have a lot of projects or of ideas or even of specialties to go in. However, whenever I was taking the therapeutic courses back in the days, I remember it was therapeutic six, number 6, and it was all about oncology. And oncology really touched my heart whenever I was studying it. And I know it might be weird, but I do love oncology. I love the science behind it. I love the disease, how it works. And this is where, in my fifth year, because the pharmacy degree in Lebanon is 5 years, so the fifth year is all about like internships, going to hospitals, doing community pharmacy. So I did mainly most of my rotations in the oncology department because I was like intrigued about knowing more. What happens with onco patients? What are the drug disease interaction, the disease interactions as well, knowing that people or onco patients um, tend to have an immunocompromised system, tend to have like much more diseases that we need to take care. And like you as a pharmacist, what's your role in it? How do you manage those patients? And then you discover that you really contribute, especially in terms of dosing and how to control the other diseases that might affect also the cancer itself. So yeah.
Amazing. And how did your passion for oncology influence your career pathway after you graduated?
Honestly, that is a very good question. So I was still back in the days in Lebanon, and I wanted to do the normal pathway that the university was pushing me to do it. So like you do PharmD, you then do residency, and then you come back and you work as a clinical pharmacist. However, certain circumstances happened in Lebanon, and since I'm also a Canadian, I ended up being in Canada. And then one of the things I said to my parents, and like while I was taking the decision whether I should move to Canada or not, I was like, okay, if I'm gonna go to Canada, I'm gonna do the equivalency. I'm just gonna practice as a community pharmacist and like, live this normal pharmacist life, right? Go into a community, do your 9 to 5, and then come back. However, I was like searching for certain like masters or like PhDs, like what are other routes that we weren't exposed to in university as a pharmacist, what should I do? And then like I was saying, the typical like masters in pharmacology, masters in kinetics, masters in all of those typical courses that you take in pharmacy school. And then I stumbled upon a new program at McGill. And the program, when I applied to that program, it was the second year that they do that program, and it was a brand new program, and it's called the Graduate Diploma in Oncology. So technically, it's a master's, but without the thesis. This is where you do like a project, and it was like specifically in oncology. And within this, the graduate diploma, there are four different aspects where you can specialize in. So either you do your graduate diploma, for example, in clinical research, graduate diploma in psychosocial and palliative care, graduate diploma in epidemiology, and graduate diploma in, I think, industry. So because like I was super attached to all the experiences that I have done in Lebanon in the oncology department, I was like, okay, you know what? I will go and I will do the graduate diploma in oncology, specifically psychosocial and palliative care, in order to know, like, especially when a cancer patient during his last days of life, how can you take care of that patient as a pharmacist? Which drug you should suspend, which drug you should continue, which drug you should discontinue. So, and especially also taking the psychosocial aspect of it and how it really also affects and deteriorates his mental health, which eventually will affect also his physical health. So I ended up doing that diploma, and I finished it in March 2023. And within the last semester, this is where you submit your project. Technically, you embark into someone's thesis. So there was someone who was doing a thesis, and his thesis was radiotherapy in onco patients, and what is the right dose that you should give to onco patients in order to avoid scarring of the tissues whenever they are subjected to radiotherapy, how you don't change the cosmeticity of the patient's body, because that also will affect his health. So yeah, so technically I worked on the thesis, and I gathered a lot of data. This is where like you go and like you look at the patient's files to see like what kind of doses they have took. Did it affect their technically it was like mastectomy. They did mastectomy and then they did a radiotherapy. Did it affect their cosmeticity? Did it affect their quality of life? Were they alive after the treatment? And what was the repercussions after they were in remission? So yeah, that was my thesis, and I graduated.
Oh, that's so fantastic. Sounds like you were like actually exposed to the in-depths of oncology.
Exactly, exactly. And like with like in this master, you learn like all different types of cancer, whether it is in the respiratory system, whether it is in the digestive system, all the type of systems, you learn them and you dwell into them. And also a part of that masters is where you take something that's called experimental medicine. What are the new drug designs that target the cancer? Like we know like it's either chemotherapy or radiotherapy, but nowadays there's more than that. There's immunotherapy, there's targeted therapy. They teach you how, like where we are at now with the clinical trials, and like how does those drugs affect certain types of cancer, and like why does this drug work for this type of cancer but not for that type of cancer. So you get the logic behind it, because you learn out of this master that not all types of cancers are the same, and not only they are not the same, but sometimes there are certain types of cancer where we think like yes, it's easy to treat. You give a course of chemotherapy, after that they should be fine. But then there is a small part that not everyone knows about it, is that sometimes the cancer tricks your body. It tells your body that yes, you're in remission, no more cancer cells are multiplying, but hey, guess what? The cancer is there, it's multiplying, but it's tricking your body. It's telling your body that those are normal cells, that they are multiplying. So that aspect really shook me, because I was like, oh, as a pharmacist, I did not even know that. So it adds a lot of impact on how you see and how you perceive cancer.
That's amazing to know. So reflecting on like what you were exposed to during your graduate diploma, how would you say it affected like your vision of what you would like to specialize in or like what you would like to work in as a pharmacist?
Honestly, when I was doing the masters, I was like, I found it. I found my passion. I'm gonna work as an oncology pharmacist. This is what I want to do. I want to specialize in it. But sometimes life offers you different opportunity, and then you embark into those opportunities, and it ends up being a different route that you have never ever thought about it in your life. So because like I was offered different things, I can say that, like, no, unfortunately, fortunately, and unfortunately, I'm no longer working in the onco field, but it's always like it's always something within me. Like you can see how passionate I am whenever I talk in oncology about oncology. So yeah, but like it did affect. That's what I wanted to do. It was my vision to continue in it, but sometimes there are different circumstances where you cannot do it, and it stays as a passion. So yeah.
For sure. Tell us, how did you land your position at L'Oréal?
Yeah, so that's a question that I've been asked several times. It's quite a fun story, because whenever we think L'Oreal, we think about like right cosmetics, about fragrances, about beauty, but we never think about like it's a medical company, or even it is like a dermatological company. Like at least that was my vision. And as a pharmacist, I did not know that pharmacists could actually work at L'Oreal. So, and even though when I was doing my pharmacy degree in Lebanon, the dermatology course was optional. So I didn't even take it. So look at where life takes you sometimes. And then I remember it was optional and I took the geriatric course. Like, who would take a geriatric course, deal with geriatric diseases with different types of indications, and like ignore the cosmetology courses or the dermatology courses, which is an easy A to take. So it was me. I was one of those people. um then what happened is that when I was doing my master's, there was this brainstorm competition happening, which is in collaboration with L'Oréal, and like where all different students around the university have the right to participate in it, whether they are in e-com, marketing, tech, or any type of degree that you have, you can participate in it. So I participated in the competition, and like you have to like create something new in relation to beauty. So we were like a group of 3 people. We participated in it, and we did not win. But like they tell you that people who participate or even who win in that competition, they have an opportunity to land an internship. And like the person who was telling us about the competition, he was always mentioning like marketing competition, like marketing internships, e-com internships. So I was like, okay, but like it doesn't have to do anything with my background. So I was like, okay, so there's no science internships, nothing related to medical. And the person was like, no, there isn't. And time passed. Time passed after we did not win the competition. After 3 months, the same person who was telling us about the internship reached out to me on LinkedIn, and he was like, hey, there is a medical communication position at L'Oréal in the medical department. Are you interested in applying? I was like, yeah, let me apply. So I applied. I had the first interview with him, and he was HR at that time, but I didn't know that I was talking to the HR. So I did the first interview with him. He explained to me a bit the role and like where does medical fit in this role. Then I had the second interview with the general manager, and she was the general manager of CeraVe back in the days. And then I had my third interview with the medical director, and then after 1 week, they told me you got the position, and I ended up working at L'Oréal in the dermatology field, which I chose to take as up didn't even choose to take as an optional course at university. So that's how I ended there.
Oh, that's a very inspiring story. So, what does your typical day at L'Oréal look like?
Yeah. So when I started the first job, so now it's my third year at L'Oréal, and like now currently I'm in my third position. So whenever I started at L'Oréal, I started as a medical communication specialist for CeraVe. And this is where like you deal with tools, you develop tools, you train reps, medical reps that actually do visit healthcare professionals. And now the position that I'm currently in is like a typical MSL position that you know, guys. Like it's called medical science liaison, but at L'Oréal we call it differently. Uh, it's typical. You are the liaison between the field team and the office team. How can you communicate your messages? How you can communicate your messages clearly to the field team? Where is your role in science? How do you connect science to business? So it's a different day to day, because your day to day is different each day. I'm not telling you like it's the normal day to day as a community pharmacist. Like I'm using right now 5% of what I learned in university, but it's nice because at the same time you learn different aspects. You learn the finance aspect, you learn the business aspect, you learn also the commercial sales aspect, you learn the PR aspect. So it's a constant learning curve where not only you're contributing medically to the position, but you're learning as well other métiers. And this is where you have the chance to link the science between the other métiers in order to promote your products and in order to put in front your products and their added values in the market.
Oh, that's amazing. How would you describe your opinion on the expanding scope of practice for pharmacists?
Actually, I'm very happy for that because I come from a country where the pharmacist can literally do anything. But of course, like in Lebanon, we weren't able like to prescribe anxiolytics, antidepressants, or even onco drugs. But whenever we talk, like for example, about antibiotics or even acne medications except isotretinoin, of course, we had more liberty to actually recommend. So when I first came to Canada and my initial vision was to do the equivalency, I was like, yes, but like you can't do anything. You're just assessing what the doctor is doing, and like all the knowledge that we as pharmacists have, like we cannot contribute to it. So now when I'm saying that the scope of pharmacists is expanding, and especially in minor ailments, which are those indications that you can treat as pharmacists, you're very well equipped to treat them. And of course, nowadays there are a lot of tools that can help you to assess and to diagnose and as well to prescribe. I was super happy to see that because we are part of the healthcare team, right? And we are the most accessible healthcare professional, especially in a country like Canada, where you only have 630 dermatologists, for example, in Canada, and like not all of them have access to them. So who is the most accessible healthcare professional? It is the pharmacist, and it's time to give him now certain authority to be able to prescribe and help the patients and hence improve their quality of life, because that what matters the most.
Nice. I'm amazed how you know like there's only 630
Yeah,
dermatologists.
there's only 630, and like it was a shock. It was like I was super shocked because like I was like Canada, like the population is big. There's around like 40 million people, and like there's only 630. I was like, but like how people can go, like let's say I have a question, like should I wait? And like it happened to me as well, because when I first moved to Canada, I didn't have a general practitioner, and like if I didn't have a general practitioner, he couldn't refer me to a dermatologist, and I still don't have a general practitioner. So who is the second person in line that I can go and visit like each 2 seconds? The pharmacist next door. So I'm happy. I'm very happy. And as a pharmacist, it does make me proud to see like my colleagues being able to dwell into this new area now, where I'm sure they can do a lot of changes.
Fantastic. I think that's all the questions I had for you. Thank you so much for being a guest speaker on my channel. It's such a pleasure.
Thank you. Thank you so much, and good luck in your career. And hopefully, I'm looking forward to see what the future holds for you.
Thank you.